Hello and welcome to this episode of our Rhinoplasty for Residents and the Foundations of Facial Plastic Surgery webinar series. We really hope you have a great time watching this show.
Back, each oral has 4 clinical cases. So after 3 hours, you're completely shattered, but you'll know if you pass. So fundamental number 1, you're part of a family. Let's get to the second fundamental of becoming a rhinoplasty expert. You have to know your anatomy and your physiology. So I want to introduce you to what's called the 3-layer concept, that the nose has an outer layer, a structure, and an inner layer. And if you can remember that within all of those, you have to go and study the osteology, the musculature, the cartilages, the vessels, the lymphatics, etc., etc. The next talk this evening is going to be going over that specifically. Next to that is you need to understand the anatomy, you have to understand the physiology. If someone can't breathe well through their nose, it has a huge impact on their life. It's not just the airflow, the humidification, the air conditioning, cleaning, but things you don't even consider. For example, someone who doesn't sleep well, or even when we get to reproduction, there's a saying that it says a good nose job is good for your sex life. You can imagine someone who's snoring and doesn't sleep well, doesn't perform well. So it's essential that you know your anatomy and your physiology, and we're going to be taking you guys through this over the next couple of weeks. Following very closely to that is to understand the pathology. And the way to go through to understand the pathology is to remember the 3-layer concept. So the pathology on the outer layer, the pathology of the structure, and the pathology of the inner layer. So you need to know what is going on the skin of the nose. We'll be giving a talk on that later. Look at the lateral wall. Remember the otolaryngologists look at a lateral and a medial wall of the nose. So on the lateral wall, you've got the turbinates, you've got ethmoidal cells. Then you've got the nasal valves. Remember, there's the inner and the external nasal valve. There's static and dynamic problems. So for example, if someone's breathing in and the nose collapses when they're breathing in, that's a dynamic problem. But if there's a constricture of the nose and it's always small, that's a static problem. You need to understand what is the difference between a deviated septum and a septal spur and how they will affect the pathology in the nose. You need to understand how important is the patient's cosmetic towards functional pathologies that you can get. And then the last point here is the psychological problems. It's massive in our rhinoplasty. We've got a dedicated talk at the end of next month on psychological problems with rhinoplasty. If we get to the 4th fundamental is the different types of surgical techniques. Now, understand all of this is book knowledge at the moment. We're not even coming close to touching a patient yet. So you need to understand what is the difference between a primary and a secondary rhinoplasty. Next Sunday night, Peter Scott's going to be taking you through the basic steps of a rhinoplasty surgically. What is the difference between an open approach rhinoplasty and an endonasal approach? Ali Reza is giving us a talk on the endonasal rhinoplasty approach at the end of September. There's a lot of talk about what's preservation rhinoplasty. And it's at the moment, it's like the most important, would I say, topic people talk about. Let's do preservation. I would want to kind of bring you back to understand before you start going down a very complex way of operating, get your basics in place first. So you need to understand what's the basic thing in terms of a functional rhinoplasty. I would advise your first ever rhinoplasty must be as functional as possible with as little cosmesis as possible so that you can get a good result the first time you do it. You need to learn what are the different kinds of incisions in terms of both the different types of incisions for an open rhinoplasty and for an endonasal rhinoplasty. What's very important with incisions is to also understand is where do you put them? Remember, you are coming into a virgin nose and you can cause damage. So you must be very careful with how carefully you work. Remember, you don't want to strangulate tissue. You want to be hard on tissue. Tissue, you need to gently treat the nose. You need to learn about the different kinds of sutures that are used in rhinoplasty. So remember the 3 steps. We're opening something, we're correcting something, and we're closing something. And to correct things, we're correcting them with 2 things. We're correcting them with sutures and we're correcting them with grafts. So these are the basic surgical techniques that we're going to teach you. So we've learned that you're part of a family to start off with. Then you need to know your anatomy and your physiology. You need to know the pathology of what you're going to deal with. Then you need to learn what the surgical techniques are. And once you have that book knowledge, now you're actually starting to get your hands onto something, and that is cadaver dissection. And I cannot stress to you how important cadaver dissection is. When I was a resident back in the day, my professor or chair asked me to do my M.Med in HPV and head and neck cancer. And I felt like sticking needles in my eyes. So I pleaded with him and I asked him, please, can I do something on rhinoplasty? And he agreed. And I ended up measuring the lateral crura of the lower lateral cartilages, and we ended up presenting it and having it published. But I did 50 cadaver rhinoplasties before I could cut one patient. And I think to me, that was a foundation that really set me up incredibly, the way I could actually learn so much about the anatomy of the nose, learning about how to do the incisions, how to actually get into the septal plane properly, how to dissect the vestibular skin off the lateral crura. It's absolutely fine thing. So rather make the mistakes on the cadavers. I could practice different grafts. You can practice putting in your kinds of sutures. Obviously, it's not the same feeling as in a live surgery. And obviously there's no bleeding, which is great. But you can also then practice on how to close the nose, etc. And this is a great opportunity for research. So I would really encourage you, take it quite seriously to do as much cadaver dissection as you can. Become absolutely familiar with it. Peter Palhazi gave us a fantastic talk on the anatomy, which you can find on the YouTube channel as well. But cadaver dissection, to me, is one of the foundations of rhinoplasty. So now we're only coming to seeing your patient for the first time. And each of these slides, we can spend hours and hours talking about. Understand that tonight's talk is giving you an overview of rhinoplasty. So this is now when we come and we actually see the patient for the first time. And your history, your examination, and your special examinations are the three parts. And in a history, you're going to really have to concentrate on listening to what the patient's complaint is. The moment somebody walks in there and they've got a hook nose, you think to yourself, oh, I'm going to take down that dorsum and they're going to look great. But the patient actually doesn't have that problem at all. So you must understand, listen to the patient. Whenever I am interviewing a patient and I need to distinguish between what are the functional questions the patient has and issues, and what are the cosmetic problems. And I always ask them, I just want 3 cosmetic problems. Let's keep this simple. Let's not look for 20 different things we can address. We want to have 3 very clear things. Remember, you need to underpromise and overdeliver. So with a history, you've got to ask questions, especially previous history. Someone will come in and say, yo, I think someone once did a septum or something. And I even last week had a patient who ended up, they had endonasal rhinoplasty. And they hadn't said that to me when I asked them. So make sure that your history is really watertight, that you don't get surprised by it. Again, the psychological side is a whole important side of that. You'll see in the middle here, we have questionnaires. You have to have questionnaires that the patient can give their subjective complaints. So you can actually see it written down. And what we often do all the time, we will have people do the same questionnaire afterwards so that I can criticize myself and say, have I improved the patient, yes or no? In terms of the examination, we'll also be talking about that in more detail, but you need to get your hands onto the patient. Remember, rhinoplasty, you're going to be right in someone's face. So make sure you have a great bedside manner. Put the patient at ease, chat to them, touch them on the leg, on the shoulder, be very professional about it, because it's not nice to have somebody right in your face. And then you slowly, I often will first start, I'll be doing a general ENT examination, feel the neck, I'll look from above, I'll slowly start touching their nose. Only later, I'm not going to jump in there straight away and put an endoscope through the nose. So make sure you have a good examination technique, that you've ticked every single box. Once I have examined the patient, I've palpated the septum, I've seen what the nasal function feels like, And I'm getting to the point where I'm quite comfortable with the patient. I've looked inside the nose. I've seen what the turbinates look like. Then we're going to do a few very important special examinations in the rooms. Okay. So the first one is photography. So I use the vector camera system and I use a 2D camera system. I've got a lady who only takes photographs for me, but photographs are essential. And there are lots of different things about that. In 2 weeks' time, Filio is speaking to us all about that. So come back for that thing about photographs. So photographs is essential, those records. The second thing that I do on my patients is I have to have an objective airflow testing. There are a couple. At the bottom right there, you can do computational fluid dynamics. In the middle at the bottom, you can use acoustic rhinometry. I use 4-phase rhinomanometry. Now, taking you back to the first time I wrote my exams, I couldn't even pronounce the difference between acoustic rhinometry and 4-phase rhinomanometry. And hence I had to do the exams again, but that's okay, as long as you get up when you fail. And what it does for me is it tests on the left here, you can see this diagram. I can test the inspiration and expiration, the fast and the slow phases. And it gives me a couple of things that are very helpful. It shows me, is there a nasal valve problem? It shows me what the pressures are like. It shows me what the flows are like. And it compares 2 nostrils to each other. And that is a very important part of my motivation to the medical aides to be able to show that the patient has a functional problem in the nose. So I will take photographs. I will do 4-phase rhinometry testing. I've done my own history. I've done my own examination. And then I'll send a patient for a cone beam CT scan, because it's very important in my eyes that we are addressing the entire nose, not just the little cartilaginous tip. So the CT scan gives me a huge amount of information, and it also gives me information to motivate to the medical aids. So what I would do is, when I first see the patient, I have done all these tests and I will send them to the CT scan, and I will only see them a few days later. And in that time, they'll be getting an email with an app that I use that has all these photographs. We've maybe morphed, we've started to talk about a few things, and I've left them with some homework for them to start thinking about a rhinoplasty. They will then come back a few days later, and then we will start talking about the surgery in more detail, especially what the surgical steps are and what the complications could be. So we'll be coming on to those things. So this is now the first time you're sitting and you're seeing the patient. Fundamental number 6. So let's get to fundamental number 7. And this is now where it starts getting exciting. So now it's the first time you're able to start getting into the operating theater. I would suggest you jump onto YouTube beforehand so you can just at least see some rhinoplasties. You will be getting that over the next few months as we teach you guys. Start building up your own instruments. So what I did is, when I was doing all my cadaver dissections, I started to build up my own instruments, because not one company has absolutely what you want. Some guys use something different. So have an open mind about that. Thirdly, this is now your opportunity to start learning how to do photography. Guys, you don't use an iPhone in theater for photographs. You need to get the proper system set up. You need a ring flash. So I've trained somebody up, but now's the time for you to learn how to take good photographs, so that when you're the surgeon, you can tell your photographer what to do. People ask me about loops. So I've visited quite widely around the world. I like using loops. Some people don't like using loops. My loops also have a little headlamp in them so that I can easily see, and I can see down into the septum, etc. I would encourage the use of loops, but it's completely up to you. What you now need to do, number 5, plan 2 steps ahead. So when you're in the surgery and you're standing next to somebody operating, think, why is that person doing that thing? And how can I be a little bit more effective? You've got to think, oh, so he's doing the osteotomies now because he wants to release something to do something else, instead of the other way around. So start thinking always 2 steps ahead. When you are there assisting, ask if you can start palpating. Start feeling what the nose feels like. Start having a feel when you're on the right plane in the septum. Then start asking if you may cut sutures. Learn how to be able to control the instruments, left hand and right hand. Once you get further along, ask if you can start putting sutures in, and you'll realize just how fragile the cartilage is, and how you have to start using both your left and your right hand, forwards, backwards, etc. Now start asking, can you dissect? So perhaps the senior surgeon will start opening the nose, and then they'll let it over to you. They might just start in the septal plane and you can dissect the rest of the septum. Or maybe you have to dissect out the lateral crura. Start dissecting. The next step would be to start carving cartilage. So if you're assisting in, for example, a rib harvest, then you can start carving, start getting the feeling of what that cartilage is like. Even if the septum's been taken out and you, for example, have to carve some spreader grafts or some articulated rim grafts or something like that, get used to the feeling of what the cartilage feels like. Then ask if you're allowed to start closing. So putting in the stitches to close up. One of my great mentors, Spencer Cochran, over in Dallas, so the Gunter diagrams, he worked for Jack Gunter for 7 years and he learned how to close. And often Jack would make him go back and have to take all the stitches out and close again because he wanted it absolutely perfectly. And then the last place you'll get to when it comes to observing and assisting is when you actually get the opportunity to do the incisions to open the nose. Let's get to the next one. Now, this is your first surgery, and this is big. So, guys, I would recommend there's a free, very interesting software program called rhinobase.net that was developed by Prof. Faisal and Prof. Dean Turiomi and a few other guys. It's very good for the start of your residency or your start of your surgery, where you goes through the whole thing. Examinations, history examinations, special examinations, photos, you plan your surgery, you print out your surgical plan, and you take it to theater. Remember, the third time you do that rhinoplasty is the first time you're cutting the skin. So what I'm trying to say there is that you've got to plan it twice before. You're going to lie awake at night thinking, what am I going to do? Even like I have a case tomorrow with a rib. I've gone through that and I'm thinking and thinking, so that by the time I'm actually cutting the skin, I've done this rhinoplasty before. So your first time is when someone's going to assist you. One of your seniors will stand there and they will assist you. It's very hard for them because they'll see you making mistakes, but you got to learn that. But the big step is when you jump out that nest and you're on your own. When there's nobody in the operating theater who's senior to you who's going to assist you. There may be a fellow or a resident or something, but you're on your own. And that's a big moment in your career. And I can clearly remember the time it happened to me, and my eyes welled up for a second or two, and I sat there and I thought, what am I doing? But eventually I realized this is what I am about. This is what I've done. This I'm trained for. But there is a time in your life when you're going to do that. I need to stress with your surgery is, please, operative notes. It is absolutely essential that you have drawings. So I use this template here, the Gunter diagrams. And I will also dictate my notes. So we completely paperless. Everything is stored on servers. But I have backup 2 years. So I'm writing so that when I go back and I can look at this, or I've written my notes, it's there. But you have to make sure you've got meticulous notes. So let's touch base here on the fundamental number 9 is follow-up and complications. So I will follow up my patients at day 7, where I'll remove all the dressings, all the sutures. I'll follow them up a month later. I'll follow them up at 6 months, at 1 year, and at 5 years. And we will be speaking to you guys about what to expect as that progresses. I need to touch base on complications. So you cut, you cry, you will get complications, but you are being trained to deal with complications. That's what's going to set you apart from somebody who just goes willy-nilly and tries and does a rhinoplasty, and someone like yourself who's actually been qualified to deal with complications. And you need to learn how to deal with the common complications and then the uncommon ones. But the common things you will get is bleeding and infections. I need to stress something very, very important. This was a patient who came to see me who had a motorbike accident and had a nasal fracture, and at the same time requested a rhinoplasty. And it ended up being a complete disaster with a nasal cripple with a large septal perforation. I need to stress with you guys, please, never, ever do a rhinoplasty on a trauma case. If it's a trauma case, fix the trauma and do the rhinoplasty later. Don't get pressurized by anybody to do a rhinoplasty on a trauma case. Fundamental number 10 is you must choose who are you going to follow in terms of the people who are very experienced. So a few things. You must choose wisely. Some people you'll get on with, some people you won't get on with. Then go to courses. Once you've gone, you learn, and then you practice what you've learned. Go to conferences. learn, and present at conferences. Don't necessarily just be a participant, be active. Go and present at conferences. It gets you out your comfort zone. In terms of publications, read widely, but publish as well. So with us, it was great to start with something small in terms of a cadaver dissection. In terms of social media, I'm going to talk about that just now. In terms of fellowships, learn and pay. Until you've actually put the money down to go and do a fellowship, it's just an idea. It was exactly the same when you probably want to start specializing. Talk about specializing until you actually put the money down and start those first exams. Same with a fellowship. Invest in a fellowship because it's investing in your future. A visitorship, you might not be as hands-on, but you can go. You can go and you can learn stuff incredibly. I've been so lucky to be around the top guys around the world, to go and visit them and sit right next to them when they operate. And the guys are so open to that. So go out and do visitorships. Finally, in terms of books, learn, and then you got to preach. So you've also got to be part of this. Go and get onto this rhinoplasty train and learn from the books. There are fantastic books out there, which we'll talk about. Let me just touch base on the second last point here, is on social media. So guys, social media can be super dangerous. I would encourage you to wait before you jump onto the social media bandwagon. You need to have good results before you even think about marketing yourself. Remember, we're doing psychological surgery. If you mess up with patients, you're in for some serious problems. In social media, everyone only puts out the absolute best cases, and everyone puts themselves out to be an expert. Now, these are big words I'm putting out there, but you need to understand social media is not always what really goes on. So be cautious. Photoshop can be used. Patient's privacy is absolutely essential. You can't, so we have we have two consents. We've got the consent for the surgery, but we consent for social media and photographs. And if patients don't want to use that, we will not use it. You got to decide, what is it that you're going to be? Are you going to be an observer, or are you going to be a participant on social media? Absolutely no problem choosing whichever one you want to. If you just want to follow guys and learn, that's great. If you want to add value, that's also great. You got to decide which platforms. You can't do all the platforms. So choose which ones are for you strategically the best. You got to choose the kind of content that you're going to post. You're going to work out what your brand is. And you have to get lawyers in to make sure that all your T's and C's are ticked. So my advice would be, wait for a few years before you climb onto social media. So the last fundamental comes down to unearthing your passion. So guys, when you're a resident or registrar or fellow, you are so busy. I want to encourage you to find some time to reflect upon what you feel is your calling. What are your passions? Where do you think you're actually good at? What are your interests? Rhinoplasty, the fact that you may be qualified as a otolaryngologist or a maxillofacial surgeon or a plastic surgeon, on paper you can do it, but that doesn't mean you can do it. So I'll be very careful. It's not a hobby. Rhinoplasty is something you really need to be able to do and do well. There's going to be a large outlay in terms of the money, the time on your relationships, and your HR. So when you're going, you're buying fancy camera systems, those kind of things, you go into congresses, it's a lot of money that's going to go into that. You've got a long learning curve. The whole point of this thing is to help you guys to shorten that learning curve and make it less steep. Some of the specialties are very comfortable with aesthetic surgery. Some people are not comfortable with that. And you've got to ask yourself that question, because rhinoplasty has a lot of cosmetic surgery. And are you comfortable working in that space or not? You got to have the ability to honestly self-criticize. When you see you've really messed that nose up, you got to go back and fix that. So if you need to be your own fiercest critic as well as your own fiercest encourager. You're part of a team. Your anesthetist, funnily enough, is probably more important than you, because they're the guys who are going to be putting your patient to sleep. So if they mess it up, the patient's going to sleep feeling anxious. So you've got to choose very carefully who your anesthetist is. You're going to deal with criticism in the future, and that could well be from colleagues and jealousy. So you must remember, stay humble, guys. There are only a handful of really brilliant world-class rhinoplasty surgeons. There are a lot of very good surgeons, but when we start and we think, oh, I'm going to have this result, man, it doesn't come that easily. And the last thing I want to share there is just follow your heart. not necessarily your head. So I want to just to have one last slide here, is touching on two things, on resources, on exams. So in terms of resources, those are the books that I've been built up over the years. Facial plastics, rhinoplasty. There's a lot of journals out there. There's courses you can attend. There's fellowships, visitorships. Reach out to all the rhinoplasty guys. I don't know there are many people in the rhinoplasty world who are not friendly. Really, the guys love going to congresses. We like this little family of people who are excited about rhinoplasty. Couple of tips about the exams. You got to know your anatomy. So if they ask you really difficult anatomy questions, either you're busy failing or you're busy getting a full marks. Know a bit about the physiology of the nose, the nasal cycle, etc. Got to know some pathology. What are the nasal valves? How do you address nasal valves? These are spot questions. Investigations. What's the difference between acoustic rhinometry, rhinomanometry, PLIF tests, etc. When you're there at your final exams, speak as a colleague to a colleague. They want to know that you're a specialist. So don't act as if you're a resident or a fellow. Be confident. Every single day you have the opportunity to practice. Every time you see a patient in the clinic, every time you're operating, it's going to be exactly the same in your exams. Please don't argue with your examiners. They know more than you. Even if you think you're right, be quiet. Just agree, okay? Don't lie. Don't say things that you didn't find on the patient. Take responsibility for yourself. Take responsibility for what you're doing. You've got to learn to de-stress. So find things to de-stress. All work and no play makes Jack a dull boy. Remember that. And finally, just enjoy what you're doing. So I've gone a little bit longer than I wanted to. I'm going to stop my sharing now. And Stewie, I'm going to just give it over to you for a minute or two if you've got any comments or questions.
Thanks. No, that was great, Cam. I think it's a great overview, and I think a lot of these topics we're going to be covering, as you mentioned, in the next 24 weeks. Cam, there are no questions. If anybody has any questions that they'd like to ask Camron, please go to the chat and type in your message. Cam, I think I'm just going to kick it off because you've asked this question of everybody. Everybody has different milestones in their rhinoplasty career, and I guess the lessons that we all learn are relevant to anybody who comes after us. So after your 10 or so years of rhinoplasty experience, this is the question you posed to everybody else. Tell me the three things in your rhinoplasty practice to date, at this stage of your career, that have probably influenced you the most, or are kind of most important in terms of your practice?
It's a great question, Stu. I wasn't expecting a question like
that. No, you weren't.
I think the single most important thing is that you have a good rapport with your patients. If I have the least bit of concern that there's something not good, things aren't right, I won't operate. You're never going to regret the guys you didn't operate on. That's the first thing. The second thing is that I learned that from one of my mentors, who's since passed on, and he would always apologize if there was a mistake. If something happened, he'd take responsibility. So I would empathize with the patient if they came back and they felt something was wrong. I wouldn't always agree with them, but it's very important that the patient can come back to me and tell me what they're not happy with, and I'll agree with them. So that's the second thing. And I think the third thing is to be inspired by the people around us. There's so many guys out there who are doing such incredible surgery, and to go and visit them and learn stuff from them, to me, is the single most important thing. Is to eat the meat and spit out the bone. Some guys, there's a lot of meat to eat. Some guys, there's just a little bit. But those are the three things for me.